Well, welcome to TrueLink Medicare presentation with the Mayo Employees Federal Credit Union. Appreciate those of you in attendance and those of you online who are watching. For those of you online, I believe you received an email already with the attachments for the folders that we hand out here in person. So again, thank you for attending. My name is Dave Brown. I'm with TrueLink Medicare Advisors. We're a division of the Minnesota Credit Union Network. So the network is the trade association for credit unions across Minnesota. We do advocacy work and all that sort of thing. And 2 years ago, we started a Medicare agency to help credit union members. I've been doing this for 18 years now and enjoy it and look forward to going through this presentation and answering any questions you have. If you're in person and you have any questions, just raise your hand or ask as we go along. You don't need to wait until the end to ask questions. If you're online, if you can submit that in the chat, we will be monitoring that and then be answering your questions as we go along. So again, thank you for attending. Move the slide. This is going to be the basics of Medicare presentation. In this presentation, we're not selling anything today. We're just here to help you better understand Medicare. We represent in Minnesota the 7 major Medicare Advantage insurance carriers. We represent several of the Medigap supplemental insurance carriers and standalone prescription drug plans. And we're going to go over all of that. Like I said, this is an educational event. We're not going to be selling anything. So, the agenda for today is why would you want to work with TrueLink Medicare Advisors? What is Medicare? What does it cover? What doesn't it cover? The enrollment periods and deadlines, costs associated with Medicare. What if you work past the age of 65? Do you need to sign up for Medicare or can you delay it? We'll talk about that. And then your private insurance options. So if any of you watch TV, especially in the months of October and November, you're inundated with Medicare ads. And around the time you turn 65, your mailbox fills up with people wanting you to sign up for Medicare through them. So this is just an example of what you see. There's a lot out there. There's a lot of clutter, and there's a lot of dishonest things that you're receiving. I've had numerous clients tell me that Social Security sent them a letter wanting their information. Social Security or Medicare does not do that. It's agencies out there who design mailing pieces to look like they're from the federal government. If you receive something like that, again, Social Security will not send you a letter saying you need to sign up or you're going to face penalties. They don't do that. It's an ad imitating to look like a federal agency. So one of the reasons that the Mayo Employees Credit Union chose to work with us is we've been vetted by them and their team, and we try to do the best job we can for you in being honest about what your options are and representing you with integrity. So our services, again, you will never pay us anything for our services. We get paid by the insurance carriers. If you sign up through us, we get paid a commission by the insurance carriers. If you sign up with a Medicare Advantage plan, the commissions are standardized. We get paid the same no matter what plan you choose or what insurance carrier. The commissions are the same. If you go with a Medigap plan, we get paid a percentage of your annual premium. So that's how we get paid. It's true of every Medicare agent out there. We will provide education and consultation. So when we meet with you for the first time, we'll go over the different options. We'll take a look at your prescription medications. We'll answer all your questions that you have. And it may be that you just want, if you meet with us, you want a planning meeting. So that's fine if you're not quite ready to sign up, but maybe you want to get your ducks in a row. We help you with all of that. And then once you sign up with us, if you choose to do that, we're available all year long to be here to answer questions. Maybe you had an issue with something you thought that should have been covered and it wasn't for some reason. We're here to be an advocate for you. And then every year, we're going to send you a letter in August or September asking you to update your medications because those can change from year to year as the plans, prescription drug plans can change from year to year. So if you respond to that letter, if you're our client, when the new information comes out on October 1, we're going to review the prescription drugs that you're currently on and see if the plan you have this year is still the right option for you for the following year. We'll do that every year for you, and there's no charge for that. We just want to make sure that you're on the right plan year after year. So we're going to go over when you should enroll in Medicare Part A and B. What documentation do you need if you wait until after the age of 65, if you're leaving an employer plan? What does Medicare cover? What doesn't it cover? Should working employees enroll in Medicare? I can address that one right now. If you're on the male employee plan, maybe your spouse is the employee or you're the employee, and you're going to continue to work past the age of 65, you do not need to sign up for Medicare Part B. I was informed earlier today that they advise you to sign up for Medicare Part A if you're on the male employee's health plan, if you're 65 or older. There's one reason you wouldn't want to sign up for Part A, and that is if the plan you have through the Mayo has an HSA, you have a health savings account. If you sign up for Medicare Part A and you have a health savings account, you can no longer contribute to your health savings account. So if you're in that situation, you have an HSA and you're going to continue working, or your spouse is, don't sign up for Medicare Part A. Otherwise, there's no reason why you wouldn't want to. And then we'll talk about late enrollment penalties and guaranteed issues and some of those things. So original Medicare, there's two parts of original Medicare that you'll get through the Social Security Administration. There's Medicare Part A, which is your hospitalization, skilled nursing, home health care. There's not a monthly premium for Medicare Part A if you or your spouse has worked in the United States for 10 years. That's the Medicare tax that gets taken out of your paycheck. That's what covers your Part A. There's deductibles for that. I'm not going to go over that because if you sign up for most Medigap plans or an Advantage plan, you're not going to have to worry about that. It just gets confusing. This would be if you just chose to have original Medicare A and B without any additional coverage, you would have that. Medicare Part B is going to give you coverage for your doctors and specialists, outpatient type things, ambulance, durable medical equipment, all those types of things. There is a monthly premium for Medicare Part B. This year, that's $185 a month. So if you sign up for Medicare Part B, if you're collecting your Social Security check at the time you sign up for Medicare Part B, that $185 a month will come right out of your Social Security check. If you're not collecting, maybe you're delaying to maximize your Social Security benefits to a later age, Social Security will send you a bill to pay the $185 a month. There's a couple ways you can do that. They bill you quarterly. On your first bill, they give you the option of signing it up to have it come directly out of your checking account. If you do that, it'll come out every month. If you prefer to mail in a check, they're going to bill you quarterly, and you're going to pay $185 times 3 every 3 months to the Social Security Administration until you start collecting your Social Security benefits. If you are collecting Social Security benefits prior to age 65, you will automatically receive a Medicare card in the mail about 3 months before your 65th birthday. You may or may not want Medicare Part A and B. So maybe you are still working or your spouse is still working and you're on their employer plan. If that's the case and your spouse is or you are collecting Social Security benefits already and you get your Medicare card automatically, there's instructions on how you can suspend your Part B coverage. The reason you would want to do that is if you're on an employer plan like the Mayo Clinic or health system, you really don't need to be paying that $185 a month for Part B. So if you're in that situation, you can suspend the Part B until you or your spouse is ready to retire and go off of the employer plan. Any questions on that? Okay. So original Medicare covers a lot of things, but there's a lot of things original Medicare doesn't cover. So they don't cover comprehensive dental. They don't give you worldwide coverage, hearing aids or hearing exam coverage, fitness benefits, routine eye exams, or outpatient prescription drugs. If you wanted coverage for these things, you need to buy additional plans for that. So we're going to talk about Medicare Advantage plans and Medigap plans. Some of these plans will give you coverage for all these things, and some won't. We're going to go into that in just a moment. Medicare enrollment periods. So there's a few different enrollment periods that would apply. The first one is called your initial coverage enrollment period. This begins 3 months before the month of your 65th birth date, the month of, and 3 months following your 65th birth date. So you have a 7-month window based around your 65th birthday in which you can sign up for Medicare Parts A and B. If you're not on an employer plan and you're retired, this is the time frame you would want to get signed up for Medicare Part A and B, and that's something we can help you with. You can go online to the ssa.gov, that's the Social Security Administration's website. You can sign up by yourself online, or you can go to your local Social Security office. But you would want to do that if you're not on an employer plan at the age of 65. If you or your spouse is on an employer plan and you're going to continue working past the age of 65, once you do get ready to retire, that moves us to the next special election period. And you would want to start this about 2 months before the month you retire. So let's say if you planned on retiring this year in September, in July, you're going to want to start working on getting signed up for your Medicare Part A and B if you haven't already done that. And when you are past the age of 65, you can tell Social Security your Part A and B will always start the first day of the month. So if you're beyond the age of 65 and you're applying for Medicare Part A or B, you can tell Social Security what month you want it to start. And you want to start that process about 2 months before you're ready to retire. Any questions on that? Okay. There is an annual election period once you are signed up for supplemental coverage, whether it's a prescription drug plan or a Medicare Advantage plan. Every year between October 15th and December 7th is when you can look at other options. Let's say you got information from your plan that they're making some changes for the next year and you don't like those changes, or they're going to drop one of the prescriptions that they covered this year. They let you know they're not going to cover it next year. Between October 15th and December 7th, you can meet with us to review other options for yourself so that you're on the right plan for the following year. And again, this is one of the reasons we send out a letter in late summer, is to make sure we have updated prescriptions for you and we can check for you to see if your plan this year is still going to cover all those prescriptions next year, because those do change from year to year, or maybe the way they charge you for that prescription changes. So we like to keep up on that, and then if you respond to that letter that we send you, we're going to notify you, yeah, your plan's changing, maybe we should get together to look at other options for yourself. So that's the time frame in which you can do that. And then several years back, Medicare added this fourth option. It's called the Medicare Advantage Open Enrollment Period. And if you have a Medicare Advantage plan and either you didn't review your options the previous year or you just assumed it was going to still work for you the following year, and maybe in January you went to the pharmacy and found out that your plan's not going to cover, like maybe you have Jardiance or Eliquis or Ozempic or something like that. They covered it last year, but they're not going to cover it this year, or it's going to be much more expensive this year. From January 1 through March 31st, if you have an Advantage plan, you have one more option to look at other Advantage plans that might do a better job of covering your needs, and you can make that change. Whatever month, January, February, or March, you choose to make that change, it will go into effect the first day of the following month, and then you would have that plan for the rest of the year. The other option you have is just dropping it entirely and going back to original Medicare. It's probably not a great idea, but it's an option that you have. Any questions on that? Yes?
So does it mean that the plan will not change, like the coverage for this medication will not change for the entire year? Is that correct?
Yes, typically they're not going to change. When they tell you they're going to cover it, it's for the year, but it can change for the following year.
Okay. But
Yeah.
at least we are guaranteed for the whole
Yes,
year.
yeah. Okay? So working past the age of 65. With some employers, their employer plans aren't very good. If you're on the Mayo employee plan, they have a very good, robust plan. So I can tell you pretty much up front that if you're going to continue to work past the age of 65 and you have the Mayo employee plan, it's a good plan. You'd want to stay with that until you're ready to retire. Their plan is deemed creditable. That is important to know because you could be penalized if it wasn't, but the Mayo plan is. And again, if you are on an HSA plan with Mayo, you're contributing to a health savings account, do not sign up for Medicare Part A because you can no longer contribute to your HSA if you do that. When you are ready to retire, you'll want to stop contributing to your HSA several months before. So if you know going into the new year, say you're going to retire in June, you'd want to let Human Resources know that you don't want to contribute to your HSA account anymore. A lot of people forget about that and slip. It's not a big deal. You'll be taxed on some of those contributions. It's not a huge amount, but you could get taxed on those for the few months that you contributed up until retirement. But ideally, you would want to stop contributing 6 months prior to when you when you retire, excuse me. You can apply for Medicare Part A and or Part B online at ssa.gov. You can contact us and we can help you with that, or you can call Social Security. I don't know if anybody's ever tried calling Social Security 800 number. You'll be on hold for an hour. Or you can go to your local Social Security office and they can help you with it too. But we're here to help if you need help with that. And then if you've already applied for Part A and you're applying for Part B because you're getting ready to retire, there's a form that you're going to need your employer to fill out for you. And it's called the Request for Employment Information. And you fill out a section, your employer fills out a section, the HR department, and what they're doing is they're verifying that you had employer coverage through them. This is what prevents you having to pay any penalties for not signing up for Medicare Part B at age 65. So when you apply for Part B, you're going to need to have this form filled out ahead of time. And if you do it online, there's a section where you can upload this form. Or if you go to the Social Security office to do it, you can take this form with you, but you need to have this form filled out. If you've worked past the age of 65 and didn't sign up for Medicare Part B, this will prevent any penalties having to pay. If you don't submit this form, you're going to pay a penalty for not having signed up at age 65. Any questions on that? You guys are an easy audience. And there's also costs. It's called the high income surcharge. So every year, thresholds are established for people who have high income, and it's called the modified adjusted gross income, MAGI. And being that we're in 2025, they're going to look, they being Social Security, and they work with the IRS, to look at your tax returns from 2 years ago. So if you apply for Medicare Part B this year, and you worked past the age 65, they're going to look at your tax returns from 2 years ago. If you file your taxes singly and your modified adjusted gross income was $106,000 a year or more, you're going to pay a surcharge on your Part B premium every month for the rest of the year. If you're married filing jointly, if your modified adjusted gross income from 2023 was $212,000 a year or more, Social Security is going to let you know that you'll be paying a surcharge on your Part B premium of $185 a month. I haven't seen an updated chart for this year yet, so these are last year's numbers, but the Part B premium this year is $185. You can see close to the amounts that your premium would go up if your income fell in those ranges. The threshold went up a little bit this year too. But you can see it can be significant if you're in the high income category. And this will go on every month for the rest of the year, and then every year after that, Social Security reevaluates your income based on your IRS tax returns from the previous 2 years, and at some point that will probably go away. So it's not a lifetime surcharge, but it will be for the rest of the year, and then it gets reevaluated. Any questions? Okay. So your private health insurance options, you have the option when you sign up for Medicare to have what's called Medigap or supplement plans. You have the option of Medicare Advantage plans, and you have the option of a standalone prescription drug plan if you go with a Medigap plan. So we'll start with Medigap plans. These are also called supplement plans. And in Minnesota, we name them differently than most of the nation does. Across the country, most of these plans are going to be called Plan F, Plan G, Plan N, Plan K, L. In Minnesota, we have different names. We call them Basic, Extended Basic, a copay plan similar to a Plan N. There's a high deductible plan similar to a Plan F. With Medigap plans, your benefits do not change from year to year. The premiums tend to go up every year, but your benefits do not change. If you choose to go with a Medigap plan, there's no networks. Any provider who accepts Medicare will accept your Medigap plan. It will travel with you if you, let's say if you live in Minnesota, or if there's any of you from Arizona and Florida online, or whatever state you're in, if you sign up for a Medigap plan and you move to another state or another county, it will travel with you. You won't lose it when you move. That's not necessarily a good thing. Minnesota tends to have some of the highest priced Medigap plans in the country. And if you move to another state, you would keep that plan, and you'd probably be paying more for it than what you would for a plan in Florida or Arizona or Texas or somewhere. And if you don't sign up for a Medigap plan within the first 12 months that you're eligible for Medicare Part A and B, in the past you would be asked health questions if you did want to sign up for a plan. The Minnesota legislature has changed that rule, and it goes into effect of October of 2026. The Minnesota legislature created an annual enrollment period for Medigap plans, just like we have for Medicare Advantage plans. So starting next fall, if let's say you started out with an Advantage plan, and as you age, you don't want to deal with co-pays or any of that anymore because you're going a lot more often to see a provider, you would be able to move into a Medigap plan starting next fall in Minnesota without the underwriting or without being asked health questions. Right now, if you wanted to move to a Medigap plan after having been on an Advantage plan for a few years, you have to answer health questions. And if you answer yes to any of those health questions, you'll be denied coverage. That's going to go away next fall because of the change in laws in Minnesota. There's two other states that I'm aware of. I think it's Massachusetts and Maine that are already doing this. Minnesota's gotten on board with that. But it gives you flexibility of not having to worry about, should I choose a Medigap plan when I first start, or am I going to be able to wait? So in Minnesota, starting next fall, if you want to start out with an Advantage plan and later on switch to a Medigap plan, you're going to be able to do that. One of the reasons I bring this up is Medigap plans can be considerably more expensive than a Medicare Advantage plan. So if you went with a company like Blue Cross Senior Gold, that plan, when you add on the riders, you have a deductible of $257 you have to pay, and then after that you don't have any co-pays for your medical. That plan this year runs $310 a month. With the Medigap plans, you don't get prescription drug coverage, you don't get dental coverage, you don't get eye coverage. So if you went with a Medigap plan and you wanted coverage for prescription drugs, you wanted coverage for dental or eyes, you would need to buy policies in addition to that amount you're paying for your Medigap plan. So they can be more expensive, but there are reasons why some people want to go with Medigap plans over Medicare Advantage plans. With Medicare Advantage plans, they're also called Part C or Part C and D together. Medicare Advantage plans in Minnesota are probably the strongest Advantage plans of any state in the country. We have insurance carriers in Minnesota where 97% of providers are in network, so it's hard to find somebody who's not in network with an Advantage plan in Minnesota. In some states, they're not very good. There are states, if I lived in one of those states, I would go with a Medigap plan, because I don't have a high opinion of their Advantage plans. In Minnesota, we have some of the best Advantage plans in the country. So with an Advantage plan, for one monthly premium, you're going to get coverage for your medical, your prescription drugs, dental, vision, and hearing. You'll get free gym membership. You'll get there's just a lot of extras you get with an Advantage plan, and they're going to run anywhere from $0 a month up to $100 or more per month. So they're more economical, but again, that's a personal decision you'll make. If you meet with us, we're going to go over the differences and what you prefer. I meet with Mayo retirees all the time. It's about half and half. Some go with Medigap plans, some go with Medicare Advantage plans. It's really your own personal decision and what you're comfortable with. Medigap plans, when you enroll, they don't ask any health questions. So your health history is not going to be a factor when you choose one of these. The benefits can change from year to year, and the premiums can change year to year. Several of the insurance carriers, their premiums actually went down this year, which is nice to see. And some of the benefits can change. With Medigap plans, again, the benefits don't change. Any questions on that? Okay. Then the Part D plans, if you were to go with a Medigap plan, you wouldn't have prescription drug coverage. So they offer what's called standalone prescription drug plans. And there's numerous companies out there that offer these. It can, again, be paired with your Medigap policy. Each company or each insurance carrier is going to have what's called a formulary, and that's a list of medications that they're going to cover. So when we meet with you, if you choose to meet with us, we're going to ask you for a list of your medications, and we're going to look them up in the Medicare Plan Finder, and that's going to give you an idea of which plan is going to be most cost effective for you, which plan is going to cover all of your medications. Some will, some won't. So those are important things you want to know. It will also tell you tiers of coverage. So in a formulary with an insurance company, they all have tiers of coverage. Tiers 1 and Tier 2 are typically the generic medications. Tiers 3 and 4 are typically brand name medications. And Tier 5 can be any specialty medications. Some also have a Tier 6, and those are for the very low-cost generics. Not all have Tier 6, but some do. But we would go over all that with you. I have met with people over the years who, when they're ready to sign up for Medicare, who say, I don't take any prescriptions and I never will, so I don't want a prescription drug plan. You don't have to sign up for a prescription drug plan. I can tell you I've had many of them come back later and say, you know, that was a mistake. I want to sign up for it because my doctor's prescribed prescriptions. They're going to pay a penalty for not signing up when they were first eligible for Medicare. And that percentage, or that penalty is a percentage of whatever the national average is that year. This year, it's about $4 a month for every year you went without. So let's say you went 5 years without prescription drug coverage and you decided to sign up for it. If you take that $4 national average times 5 years, that's an additional $20 a month you're going to pay for your prescription drug plan every month for the rest of your life. So again, it's your option whether you sign up for one or not. If you go with a Medicare Advantage plan, they include the prescription drug coverage. So I always advise people to think very carefully about if they decide they don't want to go with the plan. Again, it's your option. I'm not going to tell you what to do, but it's wise to probably sign up for something when you're first eligible. There used to be something called the donut hole, and I only talk about this because you may have heard about it before, but there was a coverage gap in your prescription drug coverage. That went away the end of 2024. And so you no longer have to worry about the donut hole. The donut hole was when you and the insurance company spent a certain amount of money towards your prescriptions, then you had to pay 25% of the cost of your prescriptions. That went away starting in January of this year. The government changed the rules and they're capping prescription costs at $2,000 per year. This isn't a true $2,000 out of your pocket. It's based on a national modeling, and there's a lot of variables to it, so it would actually be less than that. But when we meet with our clients and we enter your prescriptions, it's going to show what month, if you hit that $2,000 level, Once you do hit that level, the insurance carriers are now required to pay 100% of the cost of your medications if you reach that level. So if you're on a tier 3 medication like Eliquis or Jardiance or Ozempic, you're going to hit that level, and it's nice to know once you do, if the insurance carrier covers all of those medications, you're not going to pay anything for your medications the rest of the year once you hit that cap. So that was a good thing that was implemented this year. Yes?
So is this federal or is just a Minnesota, the state of Minnesota?
The cap on medications, that's a federal rule. Yeah. Yeah. So that happened January of this year, that started.
So if you have the Medicare, which covers the medication, does that goes to the Medicare too, or only the Part B, the 2,000?
So the 2,000 cap would, if you have a Medigap plan, you would need a standalone prescription drug plan to cover your medications. And yes, this would apply.
I meant the one that covers.
Oh, Medicare Advantage?
Yeah.
Yes, so it applies to both, yes. So if you have a Medicare Advantage plan, once you reach that cap, then you no longer pay the cost of your medications for the rest of the year.
That's include like some injection, like my sister is on infliximab.
Okay, so if you're getting in, that's a good question. If you're getting injections at a clinic or you're having infusions like chemotherapy, that's called Part B as in boy, Part B medications, and your medical plan covers that, not your prescription drug. With Advantage plans, if you're getting infusions or injections, you're going to pay 20% of the cost up until you've reached your maximum out of pocket. If you're on a Medigap plan, it depends on the type of Medigap plan you have, whether you're going to pay costs towards your infusions and injections or not.
So what is the maximum out of pocket for the Advantage?
It varies from plan to plan, and those are one of the things we go over. So those can, in Minnesota, that can start at $2,800, and it can go up from there. Other states with Medicare Advantage plans, they have, I was just helping one of the Florida Mayo employees earlier today on the phone, and Florida is very big on zero premium Medicare Advantage plans. That means you don't pay a monthly premium for it, but the maximum out of pockets for those plans can be up to $10,000. I wouldn't want that for myself personally, because it means you could be at risk of paying out $10,000. We don't have them that high in Minnesota, but like I said, in other states, if I live there, I would go with a Medigap plan as opposed to a Medicare Advantage plan, unless you're in really good health and you're not too concerned about it. So the costs of Medicare, again for Medicare Part A, we have two columns here. For the column on the left is for Medicare Advantage, column on the right is Medigap. Medicare Part A, it's a zero premium, meaning you aren't going to pay a monthly premium for your Part A. Medicare Part B is $185 per month unless you're in the high income category. And then Medicare Part C or Medicare Advantage plans, they start at $0 a month and they can go up to over $100 per month. And again, that's going to include your medical, prescription drug, dental, vision, all of that wrapped into one plan. And you'll still have to pay your $185 a month. Or with Medigap plans on the right, and again, these are prices for Minnesota Medigap plans. They start around $60. That would be for a high deductible where you pay the first $2,800 towards your costs. And they can go up to over $300 a month if you want a plan where you just pay the $257 deductible and then you don't have any co-pays after that. So they're considerably more expensive. And if you're a tobacco user with Medigap plans, it matters if you're a smoker or non-smoker. With Advantage plans, it doesn't matter. If you're a smoker with a Medigap plan, your rates are going to be higher. And then in addition to that, you would need to buy a Part D prescription drug plan if you want prescription drug coverage. Those can run anywhere from $0 a month to over $100 a month. And if you wanted dental and vision coverage, you would need to add on policies for that. Yes, sir.
So I'm not quite the Medicare age, but as a retiree, Mayo provides a monthly stipend for Part A, B, or C. Is that correct?
So it depends on when you went to work for the Mayo. They use a company called Via Benefits. Right. And if your employment started with the Mayo 2001 or earlier, Most of you are going to be eligible to get something through VIA benefits. That stipend is just shy of $1,800 a year to help you pay for things. You would need to go through them. You wouldn't want to go through us if you're eligible for VIA benefits because you wouldn't get that stipend if you went through us. So it's one of the first things I ask Mayo retirees is, when did you start working for the Mayo? I met with a woman this morning who's worked for Mayo for 40 years. So for those people, they even have an older contract where they have a retiree plan depending on when you started working for the Mayo. But there's a couple of options depending on when you started working for Mayo that you might have available to you. If you started working for Mayo after 2001, those are the folks that we're going to be able to help. We can still advise you on the direction to go, but again, if your employment started prior to 2001, you're likely have benefits available through VIA benefits, and you would need to go through them to get your Medicare coverage. Yeah, good question, thank you. So with that, you have a folder. And if you're online, you should have received an email attachment, but there's handouts in here. We do have a little free booklet we get from United Healthcare. We don't promote United Healthcare over others. It's just this is a booklet that has good information for you. So we hand that out. And then there's also a form in here. Looks like this. If you want us to help you with your Medicare at some point, if you'll fill this form out and leave it here, then we will send a follow-up email just saying thank you for attending, when do you plan on retiring or turning age 65, needing our help, and we'll communicate with you. We're not going to drive you nuts with phone calls and all that, but if you want our assistance and you fill out this card, we'll certainly be here to help you. You don't have to fill out this card. You have my business card in the folder. If you'd rather just do that and contact us when you're ready, you can certainly do that too. But those are a couple options for us to be in contact with you. Are there any questions over the presentation today? Or maybe you had questions walking in and I didn't answer them for you? Anything online? Yes?
You say you represent a number of different companies, so there are a number of different vendors of these various plans. And
Yes.
what are some of the things that you look at to determine which one you might pick over another?
Yeah, that's a good question. So obviously a monthly premium is going to matter to you, but the medications you take could be a big factor. With some of the plans, let's say you're on a tier 3 medication, Ozempic, Eliquis, Jardiance, something like that. Some of the plans, it's just they don't have a deductible for your prescriptions, and you're going to pay $47 a month for a tier 3. Other plans, you could have a deductible up over $590, and then you're going to pay 25% of the cost of your tier 3 medication. So those are some of the things we look at. Also, your providers. So like I said, some of the Advantage plans in Minnesota, 97% of providers are in network, so that's not a huge issue. Other carriers, they don't have as high a ratio of that in Minnesota. And the other thing you'd look at, especially if you went with an Advantage plan, is there's a couple different types of Advantage plans in Minnesota. There are HMO plans and there are PPO plans. If you go with an HMO plan, you're going to be limited on coverage when you're traveling. You may need referrals to go see a specialist. I tend to stay away from HMO plans these days and advise people towards PPO plans. So Advantage plans in Minnesota, if you go with a PPO plan, you're going to have a national network of providers if you're traveling, and you don't need referrals to go see a specialist. There are some carriers in Minnesota that are strong on the HMO and weak on the PPO, so those are some of the things we would look at.
Do you get a feeling for which companies are maybe easier to deal with too?
Yes. The question was, are there some companies easier to deal with? I can tell you in Minnesota we have some nonprofit companies. Those are going to be Blue Cross Blue Shield, UCare, Medica, Health Partners. They tend to be a little better at not denying claims than some of the for-profit companies like Humana. Humana's been very difficult to deal with. United Healthcare isn't quite as difficult, but again, they're for-profit and that matters to some people. But the not-for-profit, those 4 providers or 4 carriers I mentioned are going to be a little bit easier to deal with, and they don't have as high a rate of denying claims as some of the for-profits do.
Thank you.
Mm-hmm.
Could you repeat that for me?
The 4 nonprofits, so it's Blue Cross Blue Shield, and this is for Minnesota, Medica, Health Partners, and who am I forgetting? UCare. Yes, you're welcome. Yes.
Carrie asks, if you retire mid-year and have met your deductible, does that carry over to Medicare, or do you have to start over with your deductible?
You would start over with your deductible. It's going to be that deductible only applies to the plan that you're currently on. So if you retire mid-year and start a Medicare plan, the deductible that you've already paid on a different plan wouldn't apply. But for the Medicare Advantage plans in Minnesota, none of them that I can think of offhand have a medical deductible, so you wouldn't have to worry about paying a medical deductible. In some states, Advantage plans do have a medical deductible. Minnesota, we don't have that. Your plan might have a deductible towards your prescriptions, however, on Advantage plans in Minnesota. If it's a Medigap plan, it's going to depend on the type of Medigap plan whether you have a deductible or not. Yes.
I'm not sure if I'm understanding this
Okay.
but Steve F. asks, is the $1,800 that they give you for you and your spouse, does that work if your spouse does not work for Mayo? Not sure what they're referring to.
So my understanding of VIA benefits and that it's just shy of $1,800. That's only for if you work for the Mayo Clinic in Rochester. It doesn't apply to the health system employees. And if you started working prior 2001 or earlier, if your spouse is on that plan with you, when you retire, both of you would get that stipend through VIA benefits. It's always best to talk to your HR person at Mayo about that. But if you're eligible for VIA benefits and your spouse has been on your Mayo plan with you, you would both be eligible for that stipend. Yes, sir.
So if I retired prior to 65, when do you sign up or contact HR about the VIA benefits? I'm at 63 now.
Okay, so I would start that process 4 to 5 months before you reach the age of 65. Yeah.
Thank you.
And they may automatically contact you. I've had some people tell me they didn't, but yeah. Yeah. Yes.
So each year you can change, like from the Medicare plus Part D, and then next year you want to change back to the Advantage. You can switch back and forth, or it's just one way?
No, you can, starting the fall of next year in Minnesota, you can move back and forth between Medigap and Medicare Advantage plans. Right now, if you have a Medigap plan, you have a 12-month period that you can try an Advantage plan. So let's say in October and November, you're hearing all these ads about how some people think, and Medicare Advantage plans are good in Minnesota, but you would have a 12-month period you could move from a Medigap plan to an Advantage plan. And if you didn't like that in December of that year of you being on the Advantage plan, you'd need to do it by December, make that decision. You could go back to the Medigap plan you had before without any health questions being asked. And again, that's all changing the fall of next year because of what the legislature has done. But up to this point, you would have a 12-month window where you could kind of test drive an Advantage plan if you wanted to. Yes.
He's asking about what is the name of the outfit that we have to go through if your spouse has been employed there since 1990 versus you yourself and your outfit.
Yeah, so the company that the Mayo uses is called VIA, V-I-A, VIA Benefits, and you would want to contact your HR department to find out if you are eligible for that. Yes, sir.
You may have already said this, but I started before 2000, back in 80, and my wife didn't start until after 2000. So would she qualify under me then to get that $1,800 a month? Would we both be on that, or just myself?
Typically, if she came in under you as a spouse on your plan, she would. If she just signed up for her own plan when she started working, then she wouldn't if she wasn't within that time frame. Mhm. Okay, well, thank you for attending, and again, you have my contact information. Let me go to that screen. You're welcome to email me or call or text if you have any questions, and I'll be here afterwards if you have a question you don't want to ask in front of the group. But again,